finally, let's welcome Robin Ashmore and Chelsea King of Novant Health Imaging Services. Robin, Chelsea, it's such a pleasure to have you guys here today.
Thank you for having us.
Thank you.
You're quite welcome. Let's start by sharing your roles at the hospital. So we're going to start with you, Robin. What is your role at Novant Health Brunswick Medical Center?
I'm the manager of the imaging department, and that includes our outpatient facility down in Carolina Shores.
Big job.
Yes, very big job.
How about you, Chelsea? What do you do at Novant Health?
I am a CT technologist in the imaging department at the hospital.
That's awesome.
Yes, ma'am.
Great. So let's talk a little bit about how you became the director of the imaging and how you became a technologist at Novant Health.
Well, I started out as a technologist back in the early 90s and have been doing it for a long time. I've been with Novant for 18 years and just gradually moved into the management position.
Awesome. How about you, Chelsea?
What led me to Novant?
Yeah.
I graduated from Robinson Community College in Lumberton, North Carolina. I pursued and earned my associate's degree in radiography there. My initial job right out of school required me to be a multimodality tech, which required me to do x-ray and CT. So therefore, I cross-trained, self-studied, and I got my certification in CT. I've been doing this about 6 years. Luckily, this led me to Novant. It's a great opportunity. And I've been with Novant going on about a year now. I can't believe it's went by so fast.
Oh,
yes,
that's great.
Yes, ma'am.
That's great. So I know today we're here to learn about cardiac calcium scoring, correct?
Yes.
Which is something new to Novant Health Brunswick Medical Center. So tell me what calcium scoring is.
So for many people that don't know, plaque inside your arteries of your heart can build up and grow and restrict blood flow to the arteries of the muscles of your heart. A cardiac calcium score, it reflects the total area of calcium deposits and the total density of the calcium within the arteries of your heart. So when you have a cardiac CT that measures the calcium, this allows your doctor to verify and give you the possibility if you're having coronary artery disease before signs and symptoms occur.
And it could be a lifesaver.
Yes, absolutely. Yes, ma'am.
Yeah. So how do you perform this test? What do they do?
When the test is performed, we place painless sensors called electrodes on the patient's chest area. This connects to a EKG, also known as an electrocardiogram, which allows us to monitor your heart activity during the procedure. During the exam, the patient lies on a movable table that slides in and out a CT scanner. No worries, your head stays out the entire time. I know people have a common fear of that, but the scanner's open, your head stays out. Once the scanner procedure begins, we ask you to lie still, give you some breathing instructions while we take images. The CT technologist, like myself, does perform and run and operate the scanner in a room behind the patient. However, there's an open window, we can see you and we can talk to you the entire time.
Great. Well, sounds painless and very quick.
Yes, ma'am. Absolutely.
So does the scoring need a physician's referral?
It does require a doctor's order. It doesn't have to be a cardiologist. It can be your primary care physician.
So any primary care can order calcium scoring. Awesome. So then the physician would receive the results, correct?
The radiologist will read the exam once the procedure is done, and then it'll go to the doctor.
Okay, the doctor who ordered it.
That is correct, yes, ma'am.
Okay. So I understand that this particular test is not covered by most insurances. So Robin, we're going to give you a chance to talk. Tell me about that.
That is correct. Most insurance companies do not cover this.
Not even Medicare?
Not even Medicare. So what we've done is we're offering a special self-pay rate for everybody because the insurance companies don't cover it, and that rate is $99. That includes the exam and the interpretation.
I believe that's less than any other facility around offers them for.
Yes.
That's great, because I understand this can be a lifesaver.
Yes, it can.
Oh. So if somebody's watching and they think, they've had some heart issues and currently see a cardiologist, should they just talk to their doctor about it?
Yes, they should absolutely talk to their cardiologist if they're having any type of issues and can actually request that they order this exam.
Awesome. So once they're scheduled, are there any special instructions that the patient needs prior to the exam, Chelsea?
There's no particular special preparations needed.
Okay.
The patient can take their usual medications as normal. We would suggest you not drinking and avoiding caffeine for at least 4 hours, and if you're a smoker, try not to smoke 4 hours before the test.
Well, that's not too bad.
No ma'am, not at
Yeah.
all.
Well, that's really great information, and I'm glad we were able to share that today. I know that somebody in my family has recently had that and discovered quite a few blockages and are about to have cardiothoracic surgery.
Wow.
And so I understand from a personal perspective how valuable this information can be, and
Absolutely.
I would recommend it highly.
Yes.
So, Robin, I know there's lots of other things going on in the radiology department. Let's talk a few minutes about that.
Okay. Well, we're a full modality
Right.
radiology department. We offer everything. We have X-ray, we have MRI, CT, nuclear medicine, ultrasound, bone density, and mammography. We just installed our second 3D mammography unit.
That's awesome.
Yes, it is. So we are seeing close to 60 women a day doing mammograms.
Wow. And you still have the mobile unit, right?
Yes, we do have the mobile coach. It is out in the community 3 days a week, and then we take it to special events when they're offered.
That's pretty cool. And we do offer charity care for those on the mobile unit. We do take it places and do it for free.
That is correct. We have received a grant from the Komen Foundation, and we offer that for women who can't afford to have their mammograms because we believe it's very important.
Yeah, absolutely. How about the area in Carolina Shores? Do you not provide imaging services at Carolina Shores?
We do. We have an outpatient imaging facility down in Carolina Shores. We have X-ray and ultrasound there 5 days a week. We have MRI there on Wednesdays, and then generally 1 day a week the mobile mammography unit is there.
Good. Well, that is great information. And Chelsea, once again, it's best to discuss it with your primary care or your cardiologist, correct?
Yes ma'am, that's correct. To see if you're a good candidate for the test, because there's many variables that will be suitable to see if you're for the test.
Sure,
Yeah.
great. Well, thank you so much for this life-saving information
ma'am.
and for information about all the other services at Novant Health Brunswick Medical Center Imaging Department. I hope you guys will come back and tell us how it's going.
Yes ma'am,
Yes,
we will.
thank you.
Thank you.
Well, thanks again for being here.
Absolutely. Thank you.
Thank you.